If you've ever been through an episode of depression, you know how miserable that can be. When we go through depression, it affects our whole life. Our physical body is out of balance, our brain doesn't work as well, and it affects our ability to function at work, at home, at school. And our appetite, sleep, and energy are all impacted. Depression is a complex part of mental health. And when we break down the many pieces of the puzzle at the root cause of depression, it can empower us to find a path to deep healing. Welcome to Root Cause of Happiness. I'm Dr. Sarah Bryn Morrow, licensed psychologist, therapeutic yoga teacher, and optimal wellness educator. I teach the physiology of mental health and the skills to overcome suffering at the root cause. My intention is to empower others to become increasingly resilient by understanding the many pieces of the puzzle to deep healing. Please join me as we explore the root cause of happiness. Depression is unfortunately a very common human experience. In any given year, approximately 8% of American adults will have a major depressive episode, with women experiencing a slightly higher risk. Teenagers have more of a 15% incidence of major depressive episodes. We used to think 20 years ago when I went through my clinical training that depression was largely a case of bad luck in genes. We could see some heritability, meaning that depression runs in families. And when we came down with depression, it was often thought that we just had a biological predisposition, somewhat bad luck genetically, and that likely we would need a medication to manage our depression, perhaps for the rest of our lives. In the time since I went through my graduate school training, the field of psychology and mental health treatment has grown in wisdom, and we have come to realize that depression is a much more complicated issue than just bad genetics. Thankfully, as we've learned to understand more of the root cause of depressive disorders, it empowers us to realize that we, in fact, have much more control and many areas in our lives in which we can make changes that can stand a significant chance to reduce our frequency and intensity of depressive episodes. I really think that we are best served in mental health by looking at most conditions through a biopsychosocial lens of individual assessment. So what that means is that there is truly biology at play in most mental health struggles. There is root cause in the body. There is biology influencing the way that the brain is working and therefore the way that our emotions are showing up. There is also psychology. There are patterns in the ways that we think, in the ways that we respond to stress, in the history we have as far as trauma or ways we've learned to manage emotion. And then, of course, socially, our environment matters hugely. It matters if we are dealing with high levels of chronic stress, unhealthy relationships, loneliness, and lack of social support. So what we've come to realize in mental health is that depression is really not so easily defined. I like to think of depression as more of an umbrella term that covers many different underlying conditions, all of which might be leading to our experience of depressed moods. When we go through depression, we feel very dysregulated and out of balance. We tend to have a loss of energy. It can make it difficult for us to mentally focus, be productive, and function in the way we need to function each day to get our work done. We tend to feel really low drive, low motivation, like we just sort of stop caring about much of anything. That can lead to an extreme in which we actually feel hopeless about life and are at risk for suicidal ideation. In my next video, we'll be diving into suicide prevention, so stay tuned for that episode. But when we go through depression, it can really throw us out of balance and make everything feel really difficult to cope with, and our body just does not feel well. It's often that we either overeat or seek junk food to kind of comfort eat when we're going through depression, or a lot of people lose appetite completely and might actually lose weight and just not eat or nourish their bodies when they're depressed. Sometimes we sleep too much and just cannot get out of bed, cannot really wake up during the day. And sometimes we have exhaustion and yet insomnia, in which it's very difficult to sleep when we're going through depression. We can certainly feel some impact in just the way our brain is working, where we just cannot focus and think clearly the way that we normally are able to. So depression kind of derails us from being able to function effectively across environments and just do what we need to do to kind of successfully manage our lives. It makes everything kind of fall apart. So there's many factors at play. And as we look at a biopsychosocial model of what might be contributing factors to depression, it's important that we have an individual, unique view about our life. What is my history in psychology, trauma? What is my current nutritional status or toxic burden or physical health? And looking at these different pieces of the puzzle, we can start to figure out the areas in which each of us might have some choice available to us to be able to become more strategic and more intentional in how we take care of ourselves and our physical bodies, and hopefully be able to move ourselves out of depression and prevent future episodes of depression from occurring. I have come to believe that depression almost always has biology as at least one piece of the puzzle. It is really common that we see systemic chronic inflammation in depression. And there are some psychiatrists now that are actually finding treatment strategies using specific types of anti-inflammatory medications in order to help reduce levels of depression. So why might we have systemic inflammation? Part of that can be caused by eating too much sugar and simple carbohydrates that cause our blood sugar to spike and crash throughout the day. So sugar, unfortunately, is just inflammatory. It causes everything in our body to feel worse. Even if you have something like arthritis, one of the best things you can do is avoid eating sugar and wheat and probably dairy. All of those foods known to drive inflammation in the body. It's also possible that through things like pesticides and chemical contaminants in our food system, that you've developed some intestinal permeability. This is sometimes referred to as leaky gut. What that means is that the barrier that lines your intestinal tract, that is really just one cell thick, kind of like your first defense to protect the interior of the body from everything that passes through the digestive tunnel. We can get little holes and gaps in between the cells of that intestinal wall, and therefore food particles and debris of different kinds can get through the intestinal wall, and the immune system reacts. The immune system recognizes that there shouldn't be gluten protein molecules in the bloodstream, and it can cause an immune system reaction that leads to systemic inflammation. More recently, we've also come to learn that not only do you have vulnerability in your gut lining becoming permeable and therefore vulnerable to invasion and causing inflammation, but also you can have what they call leaky brain, that the blood-brain barrier that we used to think was fairly impermeable is actually vulnerable to similar assaults as the gut lining. And so if you have depression, it's really important that you find a healthcare provider that can start looking at your systemic health. They can run blood tests to look at levels of inflammation in your body. And if you have markers showing high levels of systemic inflammation, there are doctors out there that can help guide you on lifestyle changes to help reduce your immune system reactivity and lower inflammation throughout the body. So from my vantage point, always with depression and most mood disorders, it's very helpful to start looking at the physical health of the body, starting with the digestive system and looking for any causes in food sensitivities, allergies, or damage to the health of the gut itself, damage to the microbiome that might be causal factors in why the brain is not working as well as it ought to. So we look for inflammation and we try to see where can we help the body heal. There are so many different ways to help heal the gut, from rebuilding the microbiome diversity of healthy bacteria in the gut to actually reinforcing the mucous membranes of the digestive system. So there's a lot of information out there, and we don't have time to go into the details on that today, but always consider inflammation at the root cause if you're struggling with depression. Similarly, we might also have quiet chronic infections or silent hidden infections in the body. This is not an area where I feel as much of an expert because I don't study pathology like infections, but we certainly know that depression is often one of the symptoms of chronic health problems such as Epstein-Barr virus, Candida yeast infections, or even Lyme disease, chronic Lyme disease, now so much of a problem with tick-borne illnesses. And so it's possible that there could be an infection of some kind that is also impacting the immune system and therefore driving a chronic inflammation situation that is also one reason that you might feel depressed. So we want to look for damage to the health of the gut and try to heal and repair the gut. We want to look at dietary factors that might be driving high levels of inflammation. And we also want to consider, are there actual underlying health conditions, some type of infection, virus, parasite, that could be straining my body and causing my immune system to be out of balance? So those are really helpful things to work with a medical doctor on and see if they can address any physical root cause that could be one reason you're experiencing depression. Nutrients matter so much in our mental health. It really is a new concept that we've realized that we understand now what factors and nutrients are needed to be able to build the hormones and neurotransmitters that help the brain and body function effectively. This wasn't really a perspective when I went through my graduate training. There really was almost a disempowered view of mental health, as if there's just something wrong with you and we don't know why, and it's probably genetic and you might need medication. There's so much we can do now to look at the biochemistry of the body. We can run labs to look at the different levels of essential nutrients in the body and figure out where we might have deficiencies, or possibly there are genetics that are causing us to have more difficulty getting those key nutrients from the food that we eat. So we can run labs, especially through functional medicine doctors, in which they can look at, do you have enough magnesium? How is the zinc-copper ratio? Is that in balance? Do you have enough healthy fats, omega-3 fatty acids? How about B vitamins? So important to be able to synthesize and create our neurotransmitters. And so it's really helpful if we can find a functional medicine doctor, run some lab work, and try to look at your unique biochemistry and see where there are essential nutrients that might be out of balance, and therefore, in a way, your body is starving for the building blocks it needs to be able to create hormones and neurotransmitters. So neurotransmitters are really just the hormones of the brain, and hormones are chemical messengers that allow cells to communicate effectively with each other and for the body to function as it should. And so we can identify nutritional issues and supplement that through shifting lifestyle choices, adding in new foods that we haven't been eating, or even using nutritional supplementation with a doctor's guidance. So there's many things we can do to look at nutrients affecting the biochemistry balance of the body. A couple things I can easily recommend you consider if you're not able to find a doctor to help you through this is that there's very clear evidence that omega-3 fatty acids are protective against depression. So this was in 2015 that the American Psychiatric Association, for the first time, really came out publicly saying, nutrition matters. Omega-3 fatty acids, we now know, play a role in depression. So why might that be? Well, omega-3 fatty acids are these healthy fats that support the cellular membranes and allow brain cells to communicate effectively with each other. but also omega-3s are an anti-inflammatory nutrient. So omega-3 fatty acids are really helpful for all inflammatory health conditions. Similarly, we know that vitamin D is really important in mood, and most of us would benefit by taking some vitamin D3. And also turmeric, or the active ingredient curcumin in turmeric, is a strong anti-inflammatory and also has implication to be able to reduce rates of depression. So just thinking about some basic things we can do is to eat more salmon, sardines, take a fish oil supplement from a quality company where they test for heavy metal impurities. We can add in things like chia and flax and hemp seeds, walnuts, and then as much plant diversity as possible. And of course, getting some sunlight exposure for vitamin D. And I like to add in a little bit of turmeric into just about everything that I cook. So there's certain things we can do to just help create more nutrient diversity, eating more of the rainbow of plant foods, and adding in healthy nuts and seeds, beans, fruits and vegetables, and herbs for antioxidants. And all of these things are known to help support mood and prevent or reduce rates of depression. So start with taking care of your body through nutrition. And if you're lucky enough to find a functional medicine doctor to work with you, become strategic through running labs and try to get to know your unique biology and where you might have foods that are causing irritation to your system. Maybe the gut needs to be healed strategically, or at least looking to diversify nutrients and try to give your body and your brain all those essential building blocks it needs to work correctly so that you can feel well. Beyond nutrients, our body also needs movement. So depression is getting more common, and especially amongst young people. And I have to wonder that beyond the food system having changed so much over the last 20 or 30 years, the other thing that has changed a lot is electronics. And typically we have young people spending a lot of their free time on devices, tablets, cell phones, computers, and not as much time outside playing and being physically active as they used to historically. So we really need movement. It used to be that the only times that humans could sit around all day or stay in bed is when we were physically sick, injured, or dying. And so the body is not going to feel well if you're not moving in the amount of physical effort the body was really built to undergo each day. We used to have to walk miles and work physically in hard ways to meet our basic survival needs as a species. And while modern conveniences have been nice in a lot of ways, where we don't have to work so hard, what that means is that we've become increasingly sedentary. And so we have to move. Whatever form of movement you enjoy is the way to go. You shouldn't be doing exercise out of a sense of guilt or shame or obligation, but you should be creative in exploring different forms of movement that you can truly enjoy. So walking is probably one of the best forms of exercise that we're all built to be able to do. And if you're going through depression, it can feel painfully effortful to get up and go on a walk. But I would encourage you to set a teeny tiny baby step goal to at least walk for 5 or 10 minutes, one trip around the block, up the street and back home, just the tiniest bit of energy you can muster. And there's a really good chance that if you commit to just a 5-minute walk, once you're outside and you've put on your shoes and your coat and you're out there, you might find that you can keep going and perhaps make it to a 15 or 20-minute walk. And you might find that you do, in fact, feel a little bit better after that. Of course, I'm a huge fan of yoga because it has such an incredible amount of scientific research now showing the incredible therapeutic value of mindful, gentle yoga practice, where we go inward, regulate the breath, quiet the thinking mind, and work tension out of the body and encourage good blood flow and circulation as well. So the yoga literature, the scientific research, is pretty convincing. Yoga just makes us feel better and helps us move toward a place of optimal physical health, but also improved mental health. So one beautiful thing about all this technology in our lives is that you can get on YouTube and find free exercise videos, and there are thousands of yoga videos available now. I often recommend to clients they check out a channel called Yoga with Adriene. She has like 12 million subscribers. Her videos tend to be fairly short, 15 minutes or so, and gentle, so they're an accessible level of yoga for most bodies. Yoga can get really complicated and show-offy. I think of it like doing circus tricks, and it can also get a little bit different as far as Eastern philosophy. And what I like about Yoga with Adriene is that she keeps it just really comfortable and neutral. No real philosophy brought in, just a gentle self-care practice of mindful movement. So she's a great resource to know about. And of course, there's all kinds of other exercise videos online. You can look up a 5-minute little power workout. You can find exercise videos that specifically increase the nitric oxide in your body, which is really beneficial to your respiratory and circulatory system. So there's really specific things you can find. But any movement is wonderful, especially dance. So dance also has some research behind it to show that not all movement is the same. It's different to just kind of do boring reps of lifting weights versus moving your body in rhythm to music and moving with others. To move in synchronicity with other people has additional benefits for us. So you might find you just want to put on some of your favorite songs that have a nice rhythm, a high energy to them, and you might find that your energy is really low and you're really struggling. But if you can make yourself put on some good upbeat music, you find it energetically shift you to a better place. So turn to music, turn to movement, be creative in the ways that you move, and explore new outlets to see if you might find a hobby of a new movement practice that you might enjoy. I really think that there's a lot of resources now in our group meetup apps and clubs. So you might find that you want to join a hiking or walking club, or you might want to start swimming again, or to go back to something you used to enjoy when you were younger. So be willing to get out there and try something new, and just know that your body and brain will feel better and work better with daily consistent movement. Another factor in depression is exhaustion. It is very common that when we simply burn out through working too hard, being spread too thin with all of our commitments, maybe staying up too late watching TV, having a lot of stress in our lives, that we start to become depleted. And often I think of depression as kind of this crisis shutdown mode that our body will go into if we are not taking care of ourselves and balancing our energy output with our rest and relaxation. It's very important that we recharge our batteries every day. There are, of course, times that we can't get to bed quite as early as we'd like to. Sometimes we just can't sleep, which is largely out of our control. There are a lot of things we can do to improve our chances of a good night's sleep. I'll direct you back to one of my earlier videos to improve sleep, and there's a lot of information out there to help guide you towards becoming strategic in increasing the chances that you'll have consistent good sleep most nights. But we need sleep, we need rest and relaxation, and we need play. I can't remember the book, but there was one book I read where the author said that the opposite of depression is not happiness. The opposite of depression is play. And that struck me as really surprising, but also I think really intuitively accurate, that when we are in a depressed place, we don't really want to play. We lose creativity. We lose a sense of being able to laugh and be carefree and have fun. We'll often say no to social opportunity and just stay in a place of withdrawal and kind of shut down on any chances that we might enjoy an activity or something social or a chance to have fun. And we need to realize how important it is for us to have fun and to be able to be with other people in just a carefree, lighthearted way to connect and enjoy each other's company. There's a sense now that we are in an epidemic of loneliness in the United States. It seems like we're more connected now. Most of us have some kind of social media where we check in and kind of keep tabs on the people we know most days. And yet, as social media has kind of taken over the world, rates of depression and a sense of loneliness have increased consistently. I think that's very true with teenagers. And I see a lot of teens where they have people around them and they know a lot of people, but they don't really feel supported. They don't really feel they have friends that they can be vulnerable with, that they could call to get support or to talk through a bad day. They feel like they have friends for the good moments and they can, message each other, text, send photos, whatever they do, but they don't really feel they have anybody they can reach out to get support in a time of need. And they typically feel that they're the only one that feels that way. They view other people's social media and all those highlight moments, vacations and parties, and they think everyone else is socially content and fulfilled, and yet I feel lonely. And if we were to talk to each other and compare notes, what we might find is that many people, especially young people and also older people, feel lonely in this era. We've stopped coming together as communities, neighbors, multi-generational family gatherings, and we've just sort of disconnected and become more socially fragmented. So there's one thing we should all work on doing, not just for our own happiness, but also to make life better for other people. It's to reach out, to go back to these old-fashioned ways of actually picking up the phone and calling somebody and having a conversation, not a text back and forth, but talk on the phone and really have this deeper level of connection through a one-on-one conversation. If you enjoy video, of course, our video phone apps can be even better to see each other, but that can be more difficult to find the energy or desire to be on video with somebody, but we can always call. And I'd really encourage everybody to try to go back to how things used to be and call a friend today. So that's a goal I've been working on, and I would encourage everybody to try to actively increase their one-on-one social connections, talk to a friend, go on a walk together, go out to breakfast together, and just stay as close as you can with your few most special people in your life. So in my work as a child and family therapist, I typically am treating depression from an orientation of cognitive behavior therapy. So CBT is the form of therapy that tends to show the best research outcomes. And when it comes to treating depression, the research would say that we get the best outcomes through a combination of cognitive behavioral therapy and medication treatment combined. So in cognitive behavior therapy, we have this triangle model or diagram in which we show that emotion happens. Depression is simply an emotion that may show up some of the time for any of us, probably for most of us, at least occasionally in life. And while we can't make the emotion go away, we can look at thoughts called our cognitive process, and we can look at the thought process and realize that our brain is having a stream of automatic negative thought, and that there's a pattern or predictable kind of narrative that is tied with our depressed moods. So what is an emotion? It is really a set pattern of body sensation tied to a pattern of thought. So when you go through depression, you might know the body sensations, a sense of fatigue, heaviness, just feeling like gravity is weighing down on you more than usual. It might affect, again, your digestion, your sleep, your appetite, your brain. Just you don't feel well physically. There might be a sense of sadness, anger, or irritability there. But there's a thought pattern that tends to be predictable and that is there whenever you feel depressed. Usually when we're depressed, the thinking mind is going through cycles of judging yourself and your life as negative, looking at the whole world with a sense of hopelessness, like everything's terrible out there in the world. And we tend to think that the future is equally bleak, that I am not good, the world is not good, and nothing is going to get better. So hopelessness, negative judgment, pessimism tend to be predictable mindsets or a lens in which we're looking through the world at that is driving some of the depressed mood. So with awareness, we have choice to think differently if we can pause and listen and realize the stream of thought going through the brain. We can then make a conscious decision to try to teach the brain to think in a different way. So the research I like best in this realm is taught a lot by a psychologist named Dr. Rick Hanson. And he has many books, but one of his books is called Hardwiring Happiness. And Rick Hanson talks a lot about how important it is for us to exercise the brain through intentional thought, perspective taking, and behavior practices to help the brain actually wire towards increasing our pattern of positive emotion and shrinking away some of the negativity bias. So the brain's number one job really is to identify threat or potential future threat to you and be prepared to take action to run away or fight and somehow avoid that harm happening to you. So the reason that the brain has this negativity bias is because there's probably some survival benefit in seeing all the things that go wrong, not just for you, but for other people, dwelling in those bad things. So remembering bad experiences, remembering some of the catastrophes and tragedies you've heard about on the news, retelling the bad things from your day at work, journaling and wanting just to vent and complain and kind of loop through these bad things. We have a drive toward this negativity bias. Rick Hanson says that negative things tend to stick to the brain like Velcro and be hard to shake off. However, positive things tend to slip by our brain like a nonstick pan, that good things happen, we sort of see them briefly, and then we quickly forget about them. We don't tend to loop through and remember and rehash and rehearse and retell the good things in our lives nearly as much as we do the negative things. So what happens is that this negativity bias in the brain, unfortunately, over time, is shaping the brain towards more and more hardwired negative emotion. So whatever you do repeatedly shapes the brain. The neurons that are firing together are wiring together. And so when we just let the mind go unchecked, without that checking in awareness of, I'm feeling bad today, what am I thinking? Noticing negative thoughts and trying to change them. When we're just in autopilot, the thoughts are just coming and going on their own. We tend to, over time, move towards more and more negative thoughts and memories and ways of seeing the world and seeing ourselves. And we have to actively resist that and kind of tell ourselves, like, that is not helpful to go down that road. And instead, there are options for me right now to see good in myself, in the world, and to even find optimism about the future. One type of optimism about the future might just be pure impermanence, just the fact that all things continue to change and that all things are impermanent is an important realization that we need to come to sometimes to endure the short-term difficulties that inevitably arise in life. This too shall pass. Nothing lasts forever. Even though today is a hard day, good chance tomorrow will be a little bit better. Or I'm going through a tough chapter right now, but I've had other good chapters in my life, and I'm confident that I'll move through this eventually and get back to being in a better place. So there's a lot that we can do for ourselves cognitively to become aware of our patterns of negative thought, hopelessness, self-criticism, judging ourselves and others, and then even just expecting things to continue in a negative direction. And we can realize that doing that, thinking in that way, hurts us. And instead, we can make a conscious decision to choose our thoughts. One of the areas of intentional thought practice that I am always most excited about is gratitude practice. Being intentional in seeing the good and finding appreciation for whatever we can. This comes out of the field of positive psychology, largely started by Martin Seligman, and he has a book called Flourish. And what I love about the field of positive psychology is that it takes us beyond just dealing with pathology and reducing suffering, and it takes us from a place of being okay and how to move towards a place of thriving or flourishing. So we have good science now that will show that when you on purpose practice gratitude every day, your brain, your mood, your mental health patterns begin to change. So one area of research shows that if we take two groups of people that both have major depressive disorder, clinically diagnosed depression, we can prescribe medication to one group, and we typically see maybe half of people get a little bit better on medication. The data is sort of all over the place with medication outcomes. There's many factors to control for. Outcomes can look different short-term versus long-term, but roughly we'll say about half of people feel somewhat better on antidepressant medication. And we can take another group of people given gratitude practice, which means every day before bedtime usually, they're meant to just write down 3 little points of appreciation from their day. Those could be small things like, I'm grateful that I enjoyed a really nice lunch today. I'm grateful I always have had enough food to eat and have never had to go hungry. That's kind of a big point of gratitude, perhaps. Recognizing that you had a moment of enjoying the sunshine or the blue sky. Maybe you did hear from a friend today and you could be grateful for that. Being grateful that you just have a roof over your head and electricity and running water and a water heater. I mean, these things that really improve our quality of life so much, but we rarely pause and recognize them and appreciate them intentionally. So what we see is that people who do intentional gratitude practice actually will overcome depression at equal rates as people taking antidepressant medication. So there's cognitive therapy here in which we're teaching the brain on purpose to pause and see the good. There is always good to see, but we have a negativity bias, often putting the blinders on where we're only really aware of the problems and the bad things we hear on the news and, the one person at work we don't get along with, and we're missing all the beauty and all the love and the good deeds, the acts of kindness, the progress humanity is making slowly but surely over time. And we can choose to pause, zoom out, kind of broaden our perspective, and take in the good, and to hardwire happiness into the brain through intentionally savoring and soaking in the good things that do in fact happen a little bit every day. So this is cognitive therapy, to become more aware of the thought process of the automatic thinking mind and to learn how to redirect the mind towards a thought pattern that isn't fake positive. So I don't ever recommend like a real fake, everything's great, No, everything's not great, really, ever. There's always a mixed bag, right? There is hard things. There are hard things going on. And there are beautiful, wonderful things going on as well. And so we have to allow ourselves, almost give ourselves permission to let go of some of that Velcro grabbing onto the negative and let it go, and to let in some positives on purpose. I always think about the true energy of life being very much like that yin-yang symbol in which we see this equal balance between good and negative energy in the world. And I think that's probably fairly accurate. There have always been hard things happening in the world. There is pain and suffering and tragedy, loss and grief. And yet, there is so much beauty in life. There are so many amazing people and amazing things going on, and all of us blessed in many ways if we could only step back and recognize our blessings. So it's not easy and it doesn't fix everything, but it is an important piece of the puzzle to shifting your brain wiring away from that negativity bias and towards, on purpose, hardwiring happiness at every opportunity. Another factor in depression can often be what we're doing with our actual physical body. So if you could think about the energetic difference between Eeyore and Tigger from Winnie the Pooh, and Eeyore tends to be collapsed, right? So he tends to have this gaze down, shoulders hunched forward in our human body, perhaps in a self-protective posture. And then we have Tigger, who's just like upright and bouncy and energetic. And it's hard to be upbeat and really high positive energy if you're going through depression, but you can make a little shift in your body if you are aware. So again, one thing I'd recommend people consider is going to a mirror when you're hurting and look at your face and make loving eye contact with yourself. Allow yourself to just see where you might be holding the emotional pain throughout the face or in your body, and give yourself permission to make a little change. So relax your shoulders back and down, lift your heart, lift your chin, eyes gazing forward on the horizon, and loving energy into the eyes. I recently listened to a podcast with Mel Robbins, and she's teaching people to actually high five themselves in the mirror. And I've done this and you feel so goofy. It actually just makes you laugh doing this because you feel like so silly and ridiculous high-fiving yourself. But it makes you smile and laugh. And you're actually giving yourself this bit of positive energy and encouragement and like, high five, you've got this, like move forward and just keep doing your best. So there's little things we can do to just bring awareness into our facial expression, especially the energy into the eyes, our posture, and our just energy that we're carrying with us as we walk through life. And we can choose to walk a little bit faster. We can choose to breathe a little more deeply. We can choose to have this high-powered posture in the body and a positive energy throughout the face. And if we just keep trying to recalibrate and shift ourselves towards that in the energetic body, it can only stand to help, on some level, help the mood shift towards a more positive place. Of course, breathing matters hugely in mental health, and I've done some prior videos just about breathing techniques, but it tends to be that when we're depressed, we're in this collapsed posture. And that's going to compress the amount of air the lungs can actually take in each breath. And that will quicken the rate of breathing then. So one thing we can do is learn to sit up taller for the sheer reason of allowing the diaphragm more space to draw down on inhale and more room into the chest for the upper lobes and lower lobes of the lungs to expand into their full capacity with the inhale. And then as we exhale, diaphragm coming up, and trying to breathe the full breath out. So when you're feeling depressed, one thing you want to do is make sure you're breathing through your nose. So there's quite a lot of data now showing that breathing through the mouth chronically is detrimental to our mood and our mental health and brain function. So we always want to retrain ourselves to close the mouth, breathe through the nose, try to draw the breath low in the lungs, and exhale more fully on the exhale. Now, when you're going through major depression, you might just feel so tired and low energy. And one way to increase physical energy and wake the brain up is to speed up the breath on purpose. So a lot of people now have heard of Wim Hof breathing, which is more of an ancient technique called tumo breathing, And what that means is sort of over breathing on purpose, but not a fast and shallow breath like hyperventilating as if we're in fear, but a more full lung capacity breath. So breathing out to empty the lungs, breathe in from nose to belly, breathe in fully. You might even take another top off at the inhale, and then breathe out fully. Empty the lungs completely. Breathing in, fill the lungs from the bottom to the top. Breathe in again, and exhale fully. So if you do a few rounds of this kind of expanded inhale, complete exhale, and you're breathing a little bit more quickly, just kind of working the lungs into expansion and contraction, you will feel a little bit lightheaded. You'll have a shift in oxygen levels in the bloodstream, and what it will do if you're feeling tired is it will help wake you up. It's probably not a good way to breathe if you're feeling really anxious because it can actually kind of overstimulate you. So we want to breathe sometimes in a way to help wake up the brain and increase alertness in the body through shifting oxygen levels a little bit, and it'll help to increase your mental focus and overall sense of being alert and energetic. When we go through major depressive episodes, we tend to fall out of daily rhythm. So we tend to have struggles in sleeping in our normal schedule. We might eat in a different way. We might not have as much of a routine with exercise or activities. And so one step we can take in overcoming depression is to establish a daily routine. This can help conserve some of your mental energy and emotional energy, not having to make so many decisions. So it can actually be helpful to kind of get a little weekly calendar out and write down your ideal schedule. Try to be very consistent in when you go to bed and when you wake up. Try not to stay in bed more than your ideal 8, maybe 9 hours of sleep. With depression, we can sometimes just want to stay in bed and hide from the world, but we want to make ourselves get up at a normal time, even if we're feeling somewhat tired. Other things we want to do are to make ourselves bathe and just brush our teeth and shower in the routine that we normally would be taking care of our body if we were feeling well. Sometimes you just feel terrible and you don't want to get dressed, you don't want to shower, everything just feels effortful, but taking a shower might actually be a way that you feel better. Another way to shift energy in the body is to do hot-cold contrast. And so that might mean taking a hot shower, a little bit hotter than is your ideal temperature. Be careful, of course, never hurt yourself, but a little bit uncomfortably hot, followed by as cold as we can stand. And to just spend 30 seconds or so in hot to cold, hot to cold. So this will create some shift in blood flow and circulation and kind of increases energy in the body. They also think that hot and cold exposures like hot saunas, doing cold plunges, perhaps these contrast showers, are really helpful on a cellular energy level in supporting the mitochondria of our cells. So hot-cold contrast or challenging ourselves with hot and cold exposure is another physical kind of tweak we can make in biology that'll hopefully help shift us out of depression and back into more of a balanced, energetic body. So we want to work on a sleep schedule, a time to go to bed and get up. We want to commit to our hygiene practices, possibly using some hot and cold water contrast to help increase our energy. We want to have meal times. So whatever works best for you is fine, but you want to make sure that you're not kind of grazing all day and emotional comfort eating. And you also want to make sure that you're not neglecting your body's need for nutrition. So when you're depressed, it's all the more important to keep a consistent fuel source for the body and to make sure that we're nourishing the body with essential nutrients. So we want to try to avoid sugar, minimize caffeine and alcohol, and focus on plant diversity, lots of different colors to represent all those healthy antioxidants, and then healthy fats and healthy proteins. So make yourself soups and salads and smoothies, and those are going to be ways to try to minimize some of the more taxing foods we tend to eat, and maximize nutrition. So nourish the body as a way to help make sure your body has what it needs to be able to make the neurotransmitters that support stable mood in the brain. The real take-home for depression is that we have to become strategic. There are many therapeutic things we can do in biology, psychology, and socially, but we really need to have a little bit of mind over matter intention to try to act the way we wish we felt. So if you're going through a tough time and feeling depressed, one thing to ask yourself is, if I were feeling well, hypothetically, if all was well and I was in a good place mentally and emotionally, what would my day look like? What are the things that I would tend to have as part of my daily routine? How would I be building in time for exercise? How would I be reaching out and saying yes to social opportunity? And to realize that there's a lot that I can do for myself, even when it's a struggle, to kind of create this daily structure for myself that will allow me to act the way I wish I felt and increase the chances that I move through this depression more quickly and easily, and at the very least, reduce the intensity of those difficult symptoms. So we want to work on daily routine, have some rhythm and consistency in how we take care of our body and how we make sure we're getting sufficient hours in bed for sleep. We want to make sure that we are practicing mindful awareness, pausing and listening to thoughts in the mind, posture in the body, where we're holding suffering into our face, and continue to increase awareness. From awareness, trying to nudge ourselves forward into proactive self-care. So whatever that means for you, we want to try to commit to doing just the tiniest little bit of self-care that we can muster. So again, that might mean a 5-minute walk. It might mean pulling up a short yoga video and just doing a little bit of yoga in your home. It might be putting on some of that upbeat music that you do really enjoy in a good day. When you feel happy, you tend to lean towards different music than when you're feeling depressed. So choose the music that tends to feel good when you are feeling good, and that music might be more helpful. So we have to really challenge ourselves to take little micro movements, little baby steps towards on purpose taking care of ourselves, trying to find the energy to grab an apple, not a candy bar, wash and chop some vegetables if you can, and resist eating those foods that tend to drive inflammation. We want stable blood sugar. We want to keep ourselves in a nice balanced place through nutrition and not tax the body through additional toxins, pesticides, high doses of sugar in our body. We probably need to set some limits on our electronics time. So we definitely don't want to forego bedtime to stay up and watch more TV. We want to make sure that we're committing to the bedtime we know will allow us to have 8 hours dedicated to sleep. Sleep is also when the body physically repairs. That's when we can lower levels of inflammation. So sleep is not only about energy and supporting the brain working well, but it also allows the physical body to self-repair, for the immune system to be able to work effectively and to resist the body being dysregulated, in which systemic chronic inflammation becomes a risk factor that might be at the root of our depression. I hope that this video gave you some useful guidance today. It's an introduction to help you realize that there really is not one thing that we call depression. Depression is really the body's cry for help to alert you that something is not okay, something is out of balance, and probably has partial root cause in the actual biology, the physical body that you're living in. Another really wonderful book out there is by a psychiatrist. Her name is Dr. Akina Stein, and her book is called What If It's Not Depression? And in that book, she will walk you through some of these similar things we've talked about today in assessing for underlying chronic infections or pathogens that could be taxing the body, looking at inflammation, foods that could be detrimental to your mental health, foods we can add in to support key nutrients for the brain to work better and feel better. And she'll give you some guidance as well on toxins and how toxin exposure can affect your overall mental health. One little piece of medical health that could be causing depression is thyroid health. So the thyroid is just a very sensitive organ, and there are many toxins out there, pesticides and heavy metals, that can actually block some of the receptor sites in the thyroid and cause imbalances in thyroid hormones. Most people who go through thyroid health conditions will also have depression and sometimes anxiety, part of that biological struggle that they're going through. So the book by Akina Stein is another great resource to help you contemplate the different factors that could be at the root cause for why you are feeling depressed. So depression is a journey. It tends to be a chapter that people endure. And even if we do nothing, depression will typically resolve on its own. But if you don't do that detective work to assess your individual biology and root cause factors, there's a greater chance that depression will show up again at another time in the future. So we will all do better in our lives if we engage in this practice of intentional self-study to try to be curious about our mood patterns, our thought patterns, our lifestyle choices, and where we might be able to make some empowered choices to change little things in how we live day to day that can support the body and the brain being able to have optimal mental health. So keep reading, keep learning. If you're able to find a functional medicine doctor to run some labs and help guide you through a healing protocol unique to your own biology. And do think about the basics of getting enough sleep, a little bit of daily movement, making sure you're eating plant diversity and healthy fats, if nothing else, and taking care of your essential needs, like having some sense of community, talking to a friend a couple times a week, getting out of the house, breathing fresh air, being in nature. So we also know that time in nature is significantly helpful for overcoming depression. Rather than sitting in your room in isolation on a screen, go sit outside, just find a park bench or a piece of grass or a tree to sit under and be in nature if you're able to be. There are little things we can do for ourselves that as they add up, these pieces of the puzzle can lead to dramatic changes in slowly over time healing ourselves at the root cause and overcoming depression for good. I'm going to make a few more videos on this topic. I'm going to have a video for parents specifically to become strategic in supporting your child if they are dealing with depression or mood disorder symptoms. I'll have a video about suicide prevention. Please, please keep some faith and know that you can move through depression. And then I'm also going to have a video specifically to give you my favorite smoothie recipe for actually giving your brain what it needs to hopefully not feel so depressed and help energize your brain and body to feel well. Coming up, those videos will be out soon. Thanks. Thank you for joining me at Root Cause of Happiness. If this information was useful to you, please share it with others seeking knowledge and tools for resilience. It is a meaningful contribution to the world when we become proactive in our healing journeys, by learning and growing, by increasing our awareness, by addressing the root cause of happiness.